straight. So we just looked at 4 extremely effective exercises for decreasing low back pain and preventing future back injuries. But what if you don't have access to a gym or some of the equipment we've shown in the videos today? Well, I'm glad you asked. Well, let's quickly look at ways you can exercise from the comfort of your own home to achieve these same results of decreasing low back pain. So the first home exercise we're going to look at is another one designed to loosen up your back, similar to the foam roller exercise, but one you can do without any equipment. So Patrick's going to come down on his hands and knees, and he's just going to slowly flex and then extend his back all the way, getting full range of motion up and down from his tailbone to his neck. And you can repeat this as many times until you feel loose. Usually sets of 10 are good. So this next home exercise we're going to look at is similar to the plank in a way to activate your entire core and specifically target your abdominal muscles. So this is going to be a modified curl up. So Patrick's going to have one leg bent, one leg straight. You can switch or not switch, it doesn't make that much of a difference. The next you can see is he's got both hands underneath the small of his back and his head resting comfortably on the floor. So when he curls up, he's going to imagine he's keeping his spine straight like a rod and bending at the hips only. So he's going to keep his chin tucked back and he's just going to come about 2 inches off the ground. Hold that for 1 to 2 seconds and relax. And up and relax. So you can see there's not a lot of movement in this exercise, but you're getting complete engagement of the abdominals and not putting as much load on your low back, which is going to make it a safer exercise while still getting as much benefit from the muscles. This next home exercise we're going to look at is similar to the briefcase carry with the kettlebell that we just saw, which is going to be training your quadratus lumborum, your side obliques, the lateral side of your core muscles. So the first progression of this exercise is going to be on your knees and forearm, and Patrick's going to slowly lift up so he's engaging his core here. One thing is we want to keep our knees tight together. So Patrick is relaxing his legs, keeping those knees flat. You're going to get more engagement in your abs. You can go ahead and relax. So that's the first progression. The next way we can do it and make it a little more challenging is extending the legs. So Patrick's going to come up just on his feet and forearm. So this adds more challenge to the exercise. And we can hold these exercises from 10 to 20 to 30 seconds and increase your endurance this way. Now this exercise we're going to be looking at from home is going to be similar to the kettlebell swing in the fact that we're going to be adding more of a dynamic challenge to the muscles in the posterior of our core, the paraspinal muscles, multifidi, which play a large role in low back pain. So Patrick's going to come up on his hands and knees. In the first progression of this exercise, we're just going to extend one leg, and he's going to hold that leg back there, trying to keep his hips and shoulders square and his back as flat as possible, so there's no torque, no twisting. You can hold this position for 10 seconds, 20 seconds, 30 seconds. You can increase it as your endurance strengthens. Go ahead and relax. Now the next progression is going to be using the arm and the leg. So Patrick's going to go ahead and extend his left leg and his opposite side arm, so his right arm in this case, again keeping the hips and shoulders as square as possible. One way to think about it is imagine you've got a glass of water on your back and you don't want to spill it, so we can't have any twisting or bending up. Go ahead and relax. The third progression, to add a little more challenge and a little more of a dynamic element to this exercise, again we're going to extend the arm and leg. And now we're just going to do repetitive sets. We're going to be bringing the elbow and knee together to touch and back out. And again. And so we'll do a set of 10, 15. And again, trying to minimize the movement in the back. So all that movement's coming from the hip joint and shoulder joint. And one more. And so today we've looked at some of the most effective exercises you can do to decrease your low back pain, keep your back strong, and prevent future injuries. If any of these exercises are painful while you're performing them, try to modify the exercise and stay out of that painful range of motion. If your back continues to hurt for more than a week, go see your local chiropractor and have it checked out.
Ask the person to move the hips subtly from side to side like this, and ask them to stand in such a way that the weight of the body is being pressed up by the floor equally underneath both feet. That's the first part of the test, and then you look at the body to see whether there's anything to be seen. And for most people who are not trained to look this way, the curves in the spine left to right are not obvious. So what we do is we use the blocks to provoke an increase or a decrease like this. I'll lift my left heel first and ask Sharon to put the blocks underneath the left heel. Then I put my left heel down like this and then move the weight from side to side in my hips so that I can feel the floor pressing about the same left and right, which is about this point here. Lift the shoulders up and down like this, let them drop down to normal, and then ask the person who's testing you to look at the back and to make any note of the shapes that they see. You can also ask the person how that feels. Now, take a close look at the shape of my spine, and then we'll show you what it looks like when we put the block underneath the other foot. So I'll lift the left heel off the ground now, and then put it back down, and Sharon will put the blocks underneath the right heel. We once again move the hips and the weight from side to side until they're the same. You ask yourself when you're looking at your person, has anything changed? And I think you can see that both hips are more level now and the spine is looking straighter. Let me put the blocks over underneath the left hand foot once again to see the difference. You can probably see that looks completely wrong now. Now I'm using 12mm block underneath both feet, but we can actually repeat the test with only 6mm, and if the person that you're working with has a shorter leg length difference than mine, then even the 6mm blocks will make the same change to the shape of the spine. So let us just demonstrate that for you now. Sharon's going to take away one block, so there's only one block underneath my left heel, but you can probably still see that those curves that were induced by the larger amount are still there. And we can show you by transferring the block across to the other side that even though I'm only using a 6mm block, the spine looks straighter. And refer to the book Overcome Neck and Back Pain for details of what sort of inserts to use if you actually find this kind of difference in the person you're working with. Most people without quite a bit of training can't actually see the height in the hips by eye. So use a tactile technique like this. Sharon's going to bring her hands in from the side above my hips and then press her hands in towards my spine and then down onto the hips themselves. Then when I move my legs from side to side like this, very slightly, she can feel where the hips themselves are. Now she takes her hands away from the hips. We put the block underneath the left heel, as before. I redistribute my weight and she puts her hands back on the hips and then press straight down on the hips. And you should be able to see that the left hip is quite a bit higher than the right now. Now we'll change over to the other side and show you what that looks like with the blocks underneath the right foot. And again, shift the weight backwards and forwards in this subtle sideways movement. She goes straight in towards the spine and then down on top of the hips. And if we've got this right, the hips should look roughly level now. Just to show you the difference, we'll put the blocks underneath the left side once more. So take your hands away, Shaz. Change the blocks over. Put the hands back in again. And I think it should be obvious to everyone that the left hip is considerably higher than the right hip. That means we have an actual leg length difference.